All right, we're going to get started. Again, I'm Andre Bailey. Thank you so much for those joining the webinar. I'm the CEO and founder of Project Opioid. We have lots of people joining from Central Florida and around the state of Florida. And so let's go ahead and get started. Again, welcome to our webinar. We're 1 hour in today. We're going to go from 10:30 to 11:30. We are going to end promptly. And we've got a really exciting a group of speakers and leaders to talk to you about the what we're referring to as kind of the COVID-19 overdose crisis. You know, in Central Florida, around America, there was an overdose crisis fueled by opioids before COVID-19, starting, decades ago. We saw that overdose opioid crisis reach historic highs in 2018, 2017, and then 2019. But 2020 and COVID-19 has impacted communities, states around America, Florida, Central Florida, Tampa, St. Pete, Jacksonville, West Palm Beach, Miami. None of our communities have been spared, and we are really now looking towards leaders taking action. What can we do in 2021 with a historic amount of our citizens dying? So that's what we're talking about today. You guys know who I am. If you have a question, feel free to put it in the chat box in the Zoom panel. You can email us if you have a question, and we want to get to your questions. We want to answer all your questions. If you want to be involved with us, if you're new to Project Opioid, you want to be involved with us, send us an email, send me a message. We want to get more leaders involved. It's leaders that are going to make a difference on this crisis, so we want to get you involved with us. Let me first go to again, back to this statement, and this is what, if you take away only one thing, take away this from the webinar today. Overdose deaths have reached a historic level, an unprecedented, unconscionable level. What are we going to do about it? How are we going to save lives? That's the premise of what today is. I want to go to one of our co-chairs, Sheriff Dennis Lima, the Seminole County Sheriff, recently reelected by a great wide margin in Seminole County. And Dennis is just a tireless advocate from his station as a law enforcement leader. But he's a tireless advocate and has been for this overdose crisis. And so, Dennis, are you there with me? Let's test this system of Dennis, are you there?
I am. Good morning, Andre, and good morning, everyone. Can you hear me okay?
We can. It's a technological miracle, but we can hear you. So
absolutely. I want to thank everybody for joining in this morning. And I'd like just to kind of take a few moments to talk about this, because quite literally, I know many people that are on the call, and you operate in your space, whether it's substance abuse or you're an elected official leading a jurisdiction, whether it's a city or a county. I tell you, if the world had not been turned upside down this year, we would be talking about this every single day. Jurisdictions across the state and our country have seen unprecedented amounts of overdoses. Seminole County alone, 60% increase in overdoses. More than a 25% increase in overdose deaths. The unintended consequences of this COVID-19 pandemic has really led people to turn to whatever their substance was at a higher rate than ever before. We already knew that for the first time in more than 100 years, the average life expectancy of a U.S. citizen was significantly diminished because of the opioid epidemic across our country. It has now only gotten worse. I suspect that many of our leaders have been focused on making sure that we get safety messages out there. In some cases, daily news conferences when it comes to COVID-19, when this problem has been brewing underneath our nose really for the last year. When we talk about the numbers and we talk about this significant increases, let me put them in volume of number just here in Seminole County, which, we're the third most densely populated county in the state of Florida. But we've had more than 740 overdoses last year alone. More than 100 people have died of an opioid-related overdose, or another way to put that, there's never been a time in history that more people has died of anything in this county other than what we're experiencing right now. As community leaders and elected officials, it is important that we recognize that when we talk about these unprecedented numbers and these significant increases, we're only talking about 4 general touch points when we look at the statistics. Those 4 points are involvement in the criminal justice system, people who are being hospitalized because they have overdosed, people who have gone in for self-help, they've gone in for treatment for their dependency, and then unfortunately the mortality rates. It's just a small percentage of the people who actually need our help. I can only think for a moment, if every one of those families, of every one of those victims that have fallen to this, this is not a criminal justice matter, it is a public health matter. But if they were able to look in on this webinar right now at their community leaders and elected officials, they would be proud to know that we have hundreds of people gathering this morning that are talking about this, talking about the strategies that we can move forward. The greatest responsibility of any civilized society is to protect and preserve human life. And we have to use every single ounce of our political capital in order to get the message out there and help others along. And that's what Project Opioid is going to do. We will work with our community leaders in jurisdictions across the state and country to make sure that they have the strategy that works, that can be implemented. And in the end of the day, we can save lives and move forward. So thank you for your collaboration. Thank you for your partnership. Know that when COVID-19 was going on, there was always a host of Project Opioid leaders that were meeting every single week on collaboration and making sure that this stays forefront on our priority list.
Dennis, thank you for that. I do think we're going to have you back a little bit later to talk about the launch of our Overdose Initiative, because I won't be able to stress enough how important it is that we really look to move from collaboration to some tangible action steps for our community, Central Florida, and others. Dennis, talk for just a second about your new national leadership role, because as politics begin to settle, we all hope that our political climate in DC and the culture of politics right now settles into a more healthy place. But as that settles, it's going to be important that we work with the new administration in DC. Dennis, talk a little bit about some of your new national leadership roles and how those might be important to Project Opioid.
So one of the largest law enforcement organizations in the country is the Major County Sheriffs of America. Major county sheriffs represent populations of more than 500,000 residents and agencies that employ more than 1,000 employees. I was the Region 4 representative, which is the entire East Coast. But because of largely our initiatives in this space with substance abuse and mental health, and the philosophy that we feel that crime is a symptom of another problem. People typically don't wake up one day and say that they want to be a career criminal. They have now advanced me to the Vice President of the Major County Sheriffs of America, and I will ascend to the presidency of that role for a 2-year term starting in January of next year. Again, we'll serve as the Vice President this year and move to the president of that organization for the next 2 years. I've spent the past probably 3 weeks briefing incoming members of the Biden team as we make hopefully a smooth transition between people who are in positions of influence in Washington now into the new administration. And I am incredibly grateful to have a voice in that process. And Project Opioid has been a big topic of discussion when it comes to what our plans are in the future.
Great, Dennis. That's a great update. And again, we'll have you back in a little bit to talk about what specific next step leaders are going to be asked to take in Central Florida and across Florida. But thank you for your leadership, your continued leadership. For some of you that are new to the overdose crisis that's being fueled by opioids, you got to understand this. Everyone out there, you got to understand this. Local communities are only going to be as effective as the state resources, policies, and the national resources and policies really create the environment for effectiveness. A local community without state and federal resources, policies that work for them is going to really struggle. So we got to keep working at a state level. We got to keep working at a federal level. And Dennis, you're a great champion there. Thank you. Next slide. All right, so now Dr. Kendall Ward. Kendall, are you there? I think we want to talk a little bit about
the COVID-19 pandemic continues.
I'm going to come back to that in just a second. Go back one slide. All right, I'm going to show you guys a news story really quickly that came out, and then Dr. Kendall Ward and I are going to talk about the numbers. We want to dive into these numbers for just a few minutes. Project Opioid released a report late in the year. Some of you maybe missed it, but we released the state of Florida's numbers for 2020 from January to October. We'll have the full year's report of numbers soon, but I want to go through and just show you these numbers. We've had other conversations about this, but we just want to take a few minutes. But let me show you a News 6 story that came out about these numbers. This is just about Central Florida's numbers. If you're somewhere around the state, we have your county's numbers as well. And just know this, if you've not looked at these numbers yet, every county in Florida's numbers are off the charts right now. But here's a quick summary of a news story that can give you a little bit of the sense of this.
As the COVID-19 pandemic continues into the 11th month, it is pushing many people to a breaking point.
Experts say the opioid epidemic is being exacerbated around the country and right here in Central Florida. Some demographics struggling more than others. News 6's Lauren Cervantes takes a closer look at the battle many people are struggling to overcome and the resources available to help.
Well, it's a topic that caught the attention of State Rep Geraldine Thompson, who hosted a virtual forum this morning. Organizations, even doctors were on that call, saying that 2020, during the COVID-19 pandemic, saw record-breaking numbers in terms of opioid deaths.
COVID-19 pandemic has absolutely, definitively, no question about it, exacerbated the opioid crisis.
In 2020, we have seen a historic amount of individuals using drugs and overdosing and dying of opioids.
Andre Bailey, the founder of Project Opioid, was a part of the coping forum this morning, where the opioid epidemic was the focus.
You die in Central Florida and you are under 40 years old. The #1 cause of death is overdose by opioid. This is staggering.
During the 2020 COVID-19 pandemic, the largest increase in overdose deaths of any demographic was in the African-American community.
The increase among Black Central Floridians and Floridians far outpaced even those whites and Hispanics who were struggling with substances or overdosing. And we've never seen that before.
He says, according to a data survey they did of over 1,700 Floridians, they found another group was impacted: millennials and teenagers.
We had to go into these quarantines and lockdowns because of a historic pandemic, but none of us realized the mental health toll that would take on our young people.
The conversation also offered up resources like Aspire Health Partners, who offers services to those with opioid addiction.
The call center has been instrumental in getting people services. Prior to the pandemic, we were providing about 95 telehealth services a month. Now it's over 22,000 services a month.
Another resource that was mentioned on the call is a medication called Narcan, which a doctor on the call described as an opioid reversal drug. In Orange County, I'm Lauren Cervantes, getting results, News 6.
Dr. Ward, are you there? Are you?
I am.
All right. So, those numbers are just staggering. For those of you that don't know, this is Dr. Kendall Ward, the person that tried to name you all herself in this webinar. No, we sent an invite out last night, and Dr. Ward sent it out. And Dr. Ward, you embedded your name in everyone's invite, so they all became Kendall Ward. Is that what happened?
Apparently, yes, I forwarded my invite. And so if you just hit register, it auto-populated my name. So I
That's
just like to see my name.
That's all right. We're getting used to technology here. So, Dr. Ward, you helped put together this new data study, really a cutting edge, one of the first overall data studies on overdoses in any state that was released, even though it was preliminary data. Let's talk through, for those who have not seen this yet, we won't deep dive into it, but let's talk through these numbers and get your take on what they are. When what they're telling us about overdose deaths in Florida in 2020. So, Kendall, this is a chart that we've put out a lot. And for those of you that haven't seen this chart, it's important to understand that this is a chart that we got directly from the Department of Health. We did not create this chart. This is from the Department of Health, showing overdoses in 2018, 2019, and then two lines, the red line representing the actual amount of folks that have died of overdose and that have been certified through a process. The other line, the broken line, showing what the Department of Health's projections are. Kendall, talk to us a little bit about what leaders need to, what is this chart telling us about overdose deaths in Florida?
So what this chart shows us is, first, as you mentioned, the blue and the gray lines are 2018 and 2019. So as you can see, we thought that we had made some progress in overdoses in this time. But even before the pandemic, those numbers were starting to rise again in 2019. But what we really see here is that in May, as the pandemic started in March, and we went into lockdown and we went into quarantine, we're seeing an exponential growth in the number of overdose deaths in the state of Florida. So even though we don't have the final numbers for June, July, August, we can expect that those numbers are significantly higher than they have been in previous years.
Gotcha. So, and let's just really focus on this one more time. Many of you, go back to 2018, 2019. You've been involved with the overdose crisis that's fueled by opioids. And look at those blue and gray lines. When you sat with leaders, when some of our Project Opioid leaders first got together, and we were responding to this crisis based on the amount of people overdosing and dying, we thought that the blue line and the gray line was historic, unacceptable, the loss of life. We couldn't put our head around how it wasn't an issue we were taking more seriously in our communities around America, in Florida. But everyone, look at the red lines. It is really, if I had a prayer, seriously, if I almost had a prayer right now, it would be that this number of deaths isn't just lost in kind of the current environment where there's so many issues top of mind that are historic. But these numbers show that in April and May, overdoses doubled. They doubled in Florida, up almost 99%. So I just would say, Kendall, I almost feel like one of the messages that we need to put out is that these numbers are so big. I almost think some people are struggling to comprehend them. Do you kind of feel that as well, Kendall?
Yeah, absolutely. I think that one way to kind of contextualize it is to consider that if these projections are correct, which we are very confident that they are, that we're looking at 55 people a day that have died from an overdose in the state of Florida. If you really think about, that's the equivalent of a pulse shooting every day in the state of Florida. And it's easy to get lost in these huge numbers, but if you think about it as on a day-by-day basis, that's a tremendous loss of life that the state of Florida has suffered during this time.
One other thing to note, if you look at Florida going into quarantine and going into mandatory, kind of lockdowns in March, April, May, with those eased in June, look at that dotted line. I'm telling you, the Department of Health doesn't put out, if people in the Department of Health put out bad numbers, they lose their job. So this is a chart, I will tell you, I believe that dotted line is where it's going to end up. The Department of Health is banking on that. But if that's the case, and we're going to get September, October, November, December's numbers in the next few weeks, that means even after the lockdowns eased, that the numbers were still up 70, 80% around the state. So for most experts, there's a belief that these numbers don't show overdoses going back to 2019, 2018 levels. They're maintaining a historic high, which means that that COVID-19, the virus, and everything tragic that's happened in 2020, it's created a mental health crisis that's really impacted people and drove them to substances that are killing them. So Kendall, let me go to the next slide here. Let's talk a little bit about the ages of people dying. What did your research show as far as who this overdose crisis is killing most?
Yeah, the research was very clear that this is really impacting the millennial generation much harder than the older Floridians. So if you look, there's actually about 50% of the deaths are millennials in that 25 to 44 age group, and they only represent about 25% of the population of the state of Florida. So they are being impacted significantly harder than others in the state, than other age groups. And we think, there's a lot of reasons behind this and a lot of consideration given to the impact of the COVID-19 lockdowns on this age group, as well as some other, they've always been more susceptible to drug overdoses statistically.
Got it. And we didn't include this in this little brief presentation we're giving you for time's sake. Kendall, go ahead and put a link to the report in the chat, please. Sure. Just whenever, because that would be great for leaders who have not had a chance to see the full report we released in December. That would be wonderful for them to see all the information you put out. But one thing that's not in this little summary that I want to tell everyone, in partnership with Advanced Recovery and Allison Walsh, we were able to do a survey of 1,700 Floridians, of which roughly 700 of them reported they had previously struggled with drugs or alcohol, opioids. And of those 700, almost 70% of them were reporting and had reported that even though they knew that they were struggling at dangerous levels with drugs and alcohol, they realized that they had a problem, that those same individuals did not feel like they could or should reach out for help during 2020. So Kendall, we know that a historic amount of people need help and they're not able to or not feeling like they should reach out to get that help.
Yeah, that research found that really people that had experience with the system, people that were in care or people that had been in care previously, felt like they couldn't get care during the pandemic. And it really highlighted the need for, because care can be available, but it really highlighted the need for leaders to take action to make sure that people know how to access care, that people know how to navigate the system. And that's a major piece of outreach, communication, and making sure that people know how to get the care that they need.
Got it. So I think we have one more slide. Let me go to this slide now. I think this is also important. For the first time in our state's history or of any data report that we've come across, there was a disproportionate amount of an increase in deaths by race in Florida. This is something we had never seen before. We did not anticipate. Breaking this down again in layman's terms, overdoses, when you compile them together, were up for everyone. I mean, they were up around the state in every demographic. But the increase among Black Floridians and Latinos far outpaced the incredibly high increase among white Floridians and Central Floridians. So what we believe this means is that in 2020, you saw lockdowns, shutdowns, hospitals had to divert a lot of their attention, especially March, April, May, June, to COVID response. Behavioral health programs had to shut their doors. the system of care became challenged in a way it had never become challenged before. And if there is a healthcare disparity, which most experts believe there is, if you struggled before 2020 to get medical care, to get mental health services, in 2020, when you and everyone around you needed it the most, you had very little access. I think Dr. Wohl could also talk about introductions of fentanyl into drug supplies that impact certain populations. We believe that's a part of it as well. But Kendall, what are your thoughts on how the opioid crisis seems to have taken on a little bit of a social justice kind of paradigm as well?
Yeah, the data really showed that during those, those quarantine months, as you mentioned, Andre, that there was a significant increase in the number of Black Floridians that died from a drug overdose. So, because it was 125 during that time period in 2019, an increase to 263 in that time period of 2020. So it does appear that during those lockdown months that the Black population and the Hispanic population, to somewhat of a lesser degree, were adversely impacted more than the white population. And I think there's a lot of different potential reasons. As you mentioned, fentanyl has integrated itself into a lot of the cocaine supply. It has made it into other types of drugs that are more prevalent in the African American community. So I think this is definitely an area that bears further research, and it definitely bears further investigation to see how we can move forward and help this particular group.
All right, Dr. Ward, thank you so much. And
Thank
also
you.
for those that want to get a hold of you, please put your email in the chat box as well.
Sure.
We have Central Florida leaders, but we also have leaders now from around the state of Florida who are partnering with us and don't know all of us. So then thank you, Dr. Ward, for all your very important work. Let me now go to the other co-chair of Project Opioid, Kim Lobdrop, CEO of Red Lobster. Kim has been one of our tireless advocates since we began our work in late 2018. Kim, are you there? Kim, unmute yourself.
Can you hear me?
I can. Look at that. We're 3 for 3 on getting people logged in here. We're having a good day. Kim, again, you have been with us since 2018. You saw Project Opioid begin, and really a lot of leaders walked to a place where we were beginning to run with our leadership in February of 2020. And like everyone else, we've had to just hold on with both hands over the past 10, 11 months. Kim, as you look as one of the top business leaders in the state of Florida and as an advocate, you know a lot of people that have had family members who have struggled with this. What do you think community leaders need to be thinking about with these numbers now and 2021 now upon us?
Well, the numbers are certainly shocking, but they're actually not surprising. What's happening in our society is that people are under absolutely unprecedented levels of stress. People are worried about getting sick or dying. Lots of people have lost jobs or worry about that they might lose a job. Many people who have not lost a job are having to pick up work from their former teammates who lost jobs. Many people have seen savings disappear. They've seen their debts grow. The number of people who are unable to pay their rent or mortgage has skyrocketed. Some people have become homeless. Something, Andre, I know you've worked very, very hard on, and that problem looks like it could be escalating dramatically. Marriages have been strained. The rates of anxiety and depression are up, and people are self-medicating with alcohol and drugs, and that's what's leading to the dramatic rise in opioid overdoses that you and Kendall talked about. It's very encouraging that there are now effective vaccines for COVID-19 that are beginning to be rolled out. And while the initial rollout was slower than everyone wanted, over 10 million people have now gotten their first dose. And it seems likely that the COVID-19 epidemic will be largely under control by the time the year ends. But that does not mean that all the problems created by COVID-19 will disappear. For example, everybody who became addicted to opioids during the pandemic is still going to be addicted when the pandemic ends. So, we all thought we had a crisis before the pandemic with more people dying from opioids than were dying in auto accidents, with more people in Central Florida addicted to, about as many people in Central Florida addicted to opioids or dependent on opioids as who attend the University of Central Florida. We thought we had a crisis before the pandemic, and it has just gotten much worse. And it's not going to just fade away once everybody's gotten vaccinated from COVID-19 and that problem diminishes. Other interesting thing I just learned about a couple days ago, a lot of people see COVID-19 and opioids as separate issues, and clearly they're related, but it's not only that it's not only that the COVID-19 pandemic is increasing the opioid problem, but once somebody is addicted to opioids, they become 51% more likely than the general population to contract COVID-19, according to the National Institutes of Health. And if they get COVID-19, they are 37% more likely to be hospitalized and 45% more likely to die than the general population. So the COVID-19 pandemic and the opioid addiction pandemic are reinforcing each other. A year from now, the COVID-19 pandemic will probably be largely under control, but the opioid epidemic will be worse than ever unless we all intervene. And we've made a lot of progress learning how to reduce the risk of, say, employees becoming addicted to opioids. We've learned how to effectively treat opioid addiction with the right kinds of medically based treatment and counseling. We've learned how to save the lives of people who are overdosing by administering Narcan. But boy, we sure have a lot of work to do to educate people and make the needed resources readily available to those who need it. Again, I know we're all very excited about the new grant we got from Florida Blue, which Pat Garrity announced during our last call, which is going to enable us to expand our work here in not only here in Central Florida, but throughout Florida. So really appreciate all that everyone is doing. And if there are any business leaders or faith leaders on the line who are not yet involved, I would really encourage you to get involved, because if you're running a business, I guarantee you have employees who are affected by this. If you're a faith leader, I guarantee you have people in your congregation who are affected by the opioid epidemic. There are great solutions. We have an opportunity to make a big difference. And I'd like to thank everyone for all you're doing.
Kim, we have on the screen our new partners. Again, huge thank you to Pat Garrity and Florida Blue. These new business chamber, economic development collaborative partners: Jack's Chamber, Tampa Partnership, Miami-Dade Beacon Council, Greater Fort Lauderdale Alliance, West Palm Beach Business Development Board. These are 5 of the most powerful business chambers in Florida, economic development councils in Florida. Kim, for the business leaders around Florida and Central Florida, what would be one piece of advice you'd give them for business leaders to make an impact on this overdose crisis?
Well, you said one thing, and certainly at Red Lobster, well, we've done more than one thing, but we first of all tried to make it okay to ask for help. We tried to educate employees, at our general manager conferences or during a drug addiction awareness month. Educate people about the risks of becoming addicted. And about the resources we have to get help for people who had become addicted. We also, honestly, the single most effective thing I think we did was we hired Express Scripts and took advantage, which is our pharmacy benefit program manager for our employee health insurance. And we signed up for their advanced opioid management program. So if an employee gets a prescription for opioids, they have an expert look at that prescription and see if it actually makes sense. And they have, if it doesn't make sense, they directly reach out to the doctor and say, you prescribed this, tell me why you think that's appropriate. And then they often educate the doctor about research that the doctor may not have known about. And we have seen actually a majority of cases, first of all, they're often able to switch the prescription to something non-addictive or to a less addictive opioid or reduce the initial fill rate. But the overall impact of that has been quite dramatic at avoiding people becoming addicted in the first place.
Fantastic. And Kim, we're going to be getting a lot more of this information to business leaders in the next 100 days. Thank you for your leadership. And for those of you from around the state looking to get involved with one of our new Project Opioid partners, just know that these organizations are going to be launching their initiative sometime March, April, May, each of them just getting ramped up right now. So we'll keep you in the loop on those commitments as well. Let me introduce a couple team members now, and then we're going to do a Q&A and we'll get you guys off this webinar in a timely manner. We want to welcome to Project Opioid one of my good friends, Lisa Nason. Lisa is the new Director of Public Policy statewide and in Central Florida for Project Opioid. Lisa has an extensive background in public policy. She is someone who really has been on the cutting edge of a lot of great work around Central Florida, around the state, and around America. Lisa, are you there? Lisa, unmute yourself. You might be muted. I'm going to get a t-shirt that says, I love it. I've seen that shirt that says, you're on mute. Lisa, are you there?
Can you hear me now? Good morning.
We can. Lisa, so glad to have you as a team member now of Project Opioid. Tell everyone a little bit about yourself and what you're going to be doing with us.
Thank you, Andre. Good morning, ladies and gentlemen. I'm going to take just about 5 minutes to tell you about my background and give a picture of what's to come. I have followed Project Opioid since the very earliest days, and I really am delighted to officially join each of you and the statewide team. First, some background about me. After a number of years in campaign and elective politics, I began my true public service in the 1990s, serving as a special assistant for Orange County's first elected mayor, Linda Chapin. During that time, the country and the state were grappling with the public health explosion of gun violence, which led to my work with the Close the Loophole Initiative. I also worked to help implement a public health and public policy initiative that continues to this day, and which is commonly referred to as the Ryan White HIV/AIDS Initiative. Very similar to the opioid epidemic, the HIV/AIDS crisis experienced tremendous political and community stigma, but through public-private partnerships and with a solid overlay of strategic public policy and funding, HIV/AIDS is now largely viewed as a manageable, treatable, long-term health condition, precisely one of the outcomes we want to keep in mind for Project Opioid. I also served as the legislative director and chief of staff for Madison Marie, who was then the ranking majority leader in the Virginia Senate. After returning to Florida, I worked with Enterprise Florida, where as part of the nation's post 9/11 recovery efforts and under the leadership of then Governor Jeb Bush, I was privileged to help roll out the state's largest economic development and public policy innovation agenda. This, in essence, helped to establish Florida as a viable location for biotech, high tech, fledgling VC, really a turning point in our innovation economy. Until 2018, I served as the chief of strategy and public policy for Orange County's fourth mayor, Teresa Jacobs. That included a focus on chronic homelessness and veteran homelessness, working with Andre Bailey and the Impact Homelessness team, as well as the federal 25 Cities Mayor Initiative. The Central Florida region was able to achieve an effective zero rate for veterans homelessness, really a tremendous milestone. In addition, we created a solid structure for impacting chronic homelessness, really a huge impact on families, homeless teams, and our vets. And perhaps more than any other initiative, I think the public policy model used in impact homelessness relates to our Project Opioid work. For impact homelessness, we were able to identify and rank those in need, kind of a continuum of care, which for homelessness was a fairly easy task. We were able to use existing databases like United Way 211, school records, local DCF and food stamp registries. And from that, we were able to qualify individuals for underused federal programs. And it was a similar path for our veterans. However, with opioid addiction, it's precisely the same path we want to follow, but this time there's really no easy way to identify those in need. As Sheriff Lima mentioned earlier, it's really 4 ways that people come into the system: our emergency rooms and hospitals, correctional facilities, law enforcement, our mental health partners, and families in need. That is how most contact is initiated. So our work is really cut out for us. I also did staff Orange County's mayor and sheriff, their heroin addiction task force, which focused on legislative policy and Vivitrol funding for county jails around the state. So a quick look to the future. And Andre or Matt, if we could have our next slide, please. As legislative committees have already begun to meet in Tallahassee, we are aiming for a visionary statewide policy, which includes the expansion of easy access to naloxone and significantly increased mental health and treatment options, all in partnership with local leadership goals and priorities. So, as many of you know, we're already working with state and local leaders on our legislative language for this session. Thank you, Bob Cortez, Brad Richmond, as well as Dean Cannon, Robert Stewart, Chris Carmody, and the Gray Robinson team. We anticipate that a draft bill will be available in just the next few days. So a plea for action and support. For those of you who have an interest in this legislative area, we'll be having a Zoom webinar on Tuesday, January 26th at 2 p.m. That's Tuesday, January 26th, 2 p.m., where we will give a full update on the legislative status, our bill, other companion efforts, who is helping around the state. So please feel free to email me. I'm Lisa at projectopioid.org, and I'll throw that into the chat so we've got it. But in closing, I want you to know I pledge my passion and energy to each one of you and to the many families and individuals who can and will be touched by Project Opioid. To me, this is deeply worthy work and life-saving work. So I'm thrilled to be a part of the team. Thank you, Andre, and I will turn that back over to you now.
Thanks, Lisa. All of you should get in the next 24 hours an invite to this webinar. And again, we're going to have Dean Cannon, President Gray Robinson as one of our hosts. We'll have Bob Cortez, Brad Richmond, our committee chairs, helping put together really what will be an update on all of the mental health, overdose, opioid related bills that are out there right now. So don't miss that. And we're going to be excited to have you be a part. Let me just take a minute and introduce one other team member. We don't have a lot of time, but I want you to hear Houston's story. Houston Sport is our new director of community relations. And Houston, are you there? Did we get?
I am, Andre.
Awesome. So Houston, I think you're now, again, our director of community relations, but you have had a path. We're probably not going to be able to give the comprehensive version, but your path to being now a director of community relations really has 3 things that probably we talked about last night would be fascinating to a lot of folks. And the first being that you're someone who has been, clean and in recovery for 5 or 6 years. You struggled with opioids for a very long time, and now you've had a great recovery story. You're married. You've got a child on the way. Houston, yes. We know so many people are struggling with opioids. What would be the advice you would give them based on your story, and what do leaders need to know about your recovery story that really should impact how we think about what we do in 2021?
So basically, Andre, there's 3 things I like to discuss when I talk about my addiction story. I like to look at background, specifically. I like to look at timing. I think that's a huge portion for me. And then the biggest one, because it's one that keeps me going every day, is MAT, medication-assisted treatment. My background, I was blessed to have parents that were very supportive. I grew up with all the advantages. I went to school with some wonderful people. I made wonderful friends. Dr. Ward and I went to the same schools. And, I went to college, but it didn't change my path. So background for me wasn't a determining factor on whether I was going to be an addict or not. There's really not many determining factors in there. What I did look at though is where you are with your timing. My timing of quitting specifically came in 2015. I started in my addiction began in 2000. So that's about 15 years of heavy opioid use.
And Houston, I think it's important for people to know you began using opioids because you were a football player, got, DeLand High School, a really good player, wanted to play college professional, and you got hurt and doctors gave you opioids. That was how you began using.
Correct. I received my first pain pill at the age of 15 due to a knee surgery, and then received Oxycontin with a back surgery at age 16. And from that point on, it was downhill.
Got it. And again, so many interesting twists and turns that people should know. But MAT, we talk about that a lot, but medication-assisted treatment, FDA-approved medications for pain and for addiction recovery, they've played a big part in your journey. Houston, you still take buprenorphine, is it today?
I take Suboxone daily for my chronic pain and to help me with cravings, for sure. It's been wonderful. It's helped keep me alive and keep my life going.
So, Houston, we're so thankful for you being on our team. Houston's going to be one of our big ambassadors. We're going to put his email in the chat box so you can get a hold of him. But again, this is we need to break the stigma. We have this image of someone who's struggling with opioids. I think, if we're honest, communities, leaders sometimes have a stigma where it's someone from the wrong side of the tracks making bad choices. I think Houston's story is so important because he was in Kendall Ward, Dr. Kendall Ward's. They were in elementary school. They were in the same class together. They went to high school together. These are folks. Houston was someone who, his dad was a doctor, his mother a lobbyist, but these drugs are powerful. And once he got on those drugs, without some help, counseling, addiction recovery treatment, and MAT, he wouldn't be where he is today. So Houston, thank you so much. We're going to hear more from you later. Let me quickly say that we are going to be doing a big event March the 24th, where we start looking at launching something that we're calling our Overdose Initiative, where we bring folks together, specifically roll calling in the Central Florida region to start. We're going to be doing this around the state later in the year and beyond. But we really want to look at what is available. If someone like Houston and his family reaches out today to 211, to Aspire, to Project Opioid, to one of our hospitals, what's available? And that's what that person's journey of help from their community is. That's what the Overdose Initiative is. It's going to be launching March the 24th. I don't want to put you on the spot too much, Sheriff, but why is this important now that we bring leaders together and have an action plan, a tangible action plan that focuses on what help is available for families? Sheriff, why is this important?
I think it's incredibly important. It's probably the most important thing that we can do right now. And candidly speaking, I think that, there was a book written, Good to Great. The number one thing that prevents us from being great is being satisfied that we're being good. And I think if you ask jurisdictions and agencies across the state and country if they are addressing this, most will say yes. Most will find comfort that they have a task force together. But when you actually look and dig into what they're actually accomplishing, it quite frankly is little to nothing. Which is again been pretty widespread up until this point. But we have doctors and we have professionals that have spent years researching and using science-based practices to what works and what gets people healthy. The good news about this and the optimistic part about this is leaders from Project Opioid are going to give community leaders throughout the region and state the playbook to implement wonderful strategies. One of the things that I hear a lot is, well, there's not proper funding, et cetera. Let me tell you, I work very closely with the governor's office, the first lady's office, the attorney general, And these leaders are incredibly passionate about addressing not only substance abuse, but mental health, all of these underlying conditions. But the greatest news is our business leaders, as Kim laid out, after a 30-minute presentation, they're like, I'm convinced. Tell me what I can do to help out. The public-private partnership that we offer will allow us to have proper funding for assisted outpatient treatments and a variety of other things. So in the next few weeks, we'll be reaching out to let all of the community leaders, and I'm talking to my fellow elected officials that are on this call. We absolutely have to get behind this. We have to understand it, and we have to embrace a concept that science says actually works. The good news is we're going to help you do that, and we're going to give the playbook. And if we can find consistency across the region and across the state, we will build the momentum necessary across the country to save lives and to break the horrible statistics of this epidemic. Lastly, these numbers continue to skyrocket when public safety professionals are readily equipped with naloxone, the opioid antagonist that will reverse the effects of this thing. These numbers are when almost every public safety professional is using Narcan already. Can you imagine now when school starts opening again? You know, we saw all of the entry-level participation in a variety of substances. When school is in full session and in person, the number of our youth will continue to increase like we've never seen before. Now is the time.
Dennis, thank you so much. And again, 2 events then to keep in mind. We have our webinar on legislation that's going to be in 2 weeks. The link for that is being put in the chat right now. And then elected officials, our partners in the hospital system, our Babette at Aspire and Central Florida Cares, and all of our other partners, we're going to be looking at March 24th, a roll call, a state of the region on what our strategy of resources is for 2021 and beyond. So let me go quickly to our panelists. We're getting up on time. And for those of you that need to log off right at 11:30, I understand we might go 5 or 6 minutes over. Forgive us for that. We've got so many updates. I want to go to our panelists, Dr. Aaron Wall, Dr. Phil Toll, Dr. Kevin Wandler, MD at Advanced Recovery Systems. A few questions we want these folks to answer. Aaron, can you hear me all right? Are you there right now?
I can hear you very well, Andre.
Awesome. Special question just for you. What do we need to understand about MAT and its role in communities in combating the opioid epidemic? It's not something, Aaron, we hear about a lot. I think we hear a lot about, it's ironic, we have a sheriff who helps champion us, and I think we hear a lot nationally about enforcement. But I think you're someone who would say enforcement by itself, even trying to keep these drugs from coming in our country, that's not going to cut it, that we're going to need to look at MAT and how patients get treatment with it in communities. Why is MAT important, Dr. Wolf?
Well, I think actually Sheriff Lima alluded to it, and he's probably one of the most educated law enforcement officers I've met when he speaks in total, and states that it's science-based, which means we are employing evidence-based gold standards of practice for addiction treatment. And why is medication specifically for opioid use disorder evidence-based? It's because we have 20 to 30 years of evidence that shows that these medications are what is necessary to help these patients stay alive and be more receptive to the emotional training, the cognitive behavioral therapy, and the counseling that our addiction counselors can provide. So what these medications do very basically is they occupy the brain receptors that heroin and other opioids like fentanyl bind to. That normalizes their brain chemistry. You can ask Houston, you can look at Houston speak. He's an absolute perfect spokesman for being on Suboxone or buprenorphine. And it relieves these patients' physiologic cravings. It prevents the excruciating symptoms of withdrawal that usually throw patients back into relapse. It normalizes their body function. And if you dose medication-assisted treatment correctly, it does not impair any functioning. This is important for CEOs, such as Mr. Lobdrop. These folks, there's no negative effects on their intelligence, their mental capability, their physical functioning, or their employability. And I want to stress again, it's not it's not an island. We don't use MAT in an island. We put patients on medication-assisted treatment so that they can better be receptive to the counseling and the emotional resilience training that goes along with addiction counseling.
And Aaron, let me ask you a quick, just really quick follow-up. This is a dumb question for a guy like you, but I think people need to hear it. Is there enough MAT available in communities at Central Florida and across Florida? If someone's reaching out for this life-saving medication, is it easy to get?
No, it's not easy enough to get. I've always stated, that if we made MAT more available than it is on the street to get high, we could solve our crisis. And despite all of our addiction treatment centers doing their best to up-regulate all their providers to give MAT, it's just simply not available enough. There are some simple solutions in a sense, simple but not easy. States could better educate the public about what works and what doesn't, specifically that if their loved one is suffering from opioid use disorder or addiction to opioids, they should definitively be placed on medication-assisted treatment. States should really work to expand MAT access, and as Sheriff Lima mentioned, the governor's office and Casey DeSantis are working towards these solutions, and they're receptive to our suggestions for policy. We need to make Medicaid managed care plans pay for MAT and diminish any pre-authorization. And then because many of these folks are uninsured or underinsured, as a state, we really have to come up together, we have to think outside the box to find creative solutions and ways to help fund and facilitate more robust outpatient addiction treatments facilities that utilize MAT. I just want to quickly say that a report from the National Academy of Sciences and Engineering and Medicine came out in March of 2019, just a year before the COVID hit. And it gave 7 conclusions. One of its major conclusions that I love to read to folks is that medication-assisted treatment is effective across all treatment settings studied to date, withholding or failing to have available all classes of FDA-approved medication for the treatment of opioid use disorder in any healthcare or criminal justice setting is denying appropriate medical treatment. So we must stop denying this appropriate medical treatment to our patients, and we have to find creative solutions to fund it.
Thanks, Dr. Wall. We have 2 questions left. We're up on our time, so let me give you some specific feedback right now. I'm going to give you guys kind of the end of the webinar in the next 60 seconds. But then for those that need to log out, you can actually get this recording and watch the last 7 or 8, 9 minutes of it. Where we go from here, I'm excited to just announce quickly a partnership with Solutionize. None of you know who that is, but Solutionize is an amazing organization that has built really a continuum of care in Indiana, the entire state of Indiana, around addiction, a broad continuum around addiction and overdoses. We are partnering with them. This is hot off the presses. Their leadership is actually on this webinar. Peter, thanks for being on. We're going to create a one-stop platform, cloud-based platform, where all of the behavioral health providers, all of our partners, government partners, are working together both in Central Florida and eventually around the state. And this is the main thing you need to know. It's patient focused. So if someone is at risk of dying of overdose, we're going to have a continuum that walks with them. They've done this already in Indiana, so we're very excited about that. Don't forget about our legislative webinar. The link is in the chat. Dean Cannon from Gray Robinson, president of Gray Robinson, former president of the Florida Senate, is going to be helping host this with us with his Gray Robinson team. Bob Cortez, Brad Richmond, others. There's so many important bills we need to look at. We're going to go over those and talk about them January the 26th. And again, I'm going to go back in just a second. And we have 2 more questions. We're going to go into overtime, but if you have to log out in a minute, don't forget about our big event, May the 24th, where we're going to start moving from just coalition building to our system of care, our overdose initiative, as we also look towards our advocacy. So if you need to log off, but don't log off, because you're going to miss the best question answer session ever. And don't lie, you don't have another meeting. You're lying. You're just wanting to go watch more politics on TV. So TiVo that and listen to these last 2 questions. But in all seriousness, thank you for joining our webinar. If you do need to log off, we understand. All right, Kevin, Dr. Kevin Wandler. Kevin, do you have just a couple more minutes to answer?
Yeah, I do. Thank you so much.
So question for you, and I just wanted to be cognizant of people's time. If you're still on, thank you. We're going to get off. We're going to finish in the next 5 to 7 minutes. Why did the COVID, question for you, Dr. Wandler, why did the COVID-19 pandemic seem to have such impact on those struggling with addiction? How do we help people move forward who were already struggling before COVID-19 and now they're just devastated? What do leaders do, Dr. Wandler?
Yeah, it was said already. I forget who mentioned all the stress we have. I mean, that really is what pushed us over. I mean, COVID is a pandemic stress. We've never seen anything like it. It's affected me, it's affected you, it's affected everyone on this call, and certainly all of my patients. And unfortunately, stress is something we all deal with every day. We have stress just getting up in the morning, brushing our teeth. But now, as we've said, people don't have jobs necessarily. People may be, their kids, are they in school or are they not in school? And what if you're the primary or your primary worker and your kids have to be home? I mean, it just goes on and on, the amount of crisis we've had. Most of us deal with stress somehow, right? But for our patients that are use opioids or other drugs and alcohol, it's almost doubled the use. I mean, you're seeing that in overdoses, and the use is doubled. I mean, some of the data that we have, and we partnered with Project Opioid on some of this data collection, shows that there's a 25% increase in opioid use from occasional use to daily use to even multi-day use just since the pandemic. Alcohol use is up 100%, 100% or more. I mean, it's crazy. And so that's what the pandemic has done, is that among many things, it's increased our stress levels to the point that people are not able to cope. So how do we move forward? Well, more mental health services. I know many clinics and offices have closed and they're doing teleservices. We're doing teleservices. And it's not the same. I mean, our hospitals, our residential treatment programs are open, but much of our outpatient services are tele. And I'm a psychiatrist first and an addiction medicine provider as well. It's not the same, but it's better than nothing. Dr. Wall had some great points about MAT, and there is not enough MAT providers out there. Last year, right before COVID, we were ready to roll out a huge MAT project, and we put it on hold because we want to be able to meet people face to face, get their drug screens, et cetera, et cetera. We do push MAT a lot, and it was my initiative last year is to get our patients to accept it. We offer it to 100% of opioid using patients and alcohol use disorder patients, and my initiative was to get them to accept it. And there's even financial issues with that. I mean, Suboxone or buprenorphine products are not free. Sublocade, which is a long-acting buprenorphine product, is very expensive. Even if you have third-party insurance, it can be very expensive and then rate limiting.
Well, Dr. Wandler, when we do our big push, March the 24th, we'd love to talk to you and your team about highlighting that program, both here and around Florida and beyond. So thank you for your work, Advanced Recovery Systems. Allison Walsh, you guys have been amazing. So we will look to help you promote that MAT program and other MAT programs. Let me go quickly to Dr. Phil Toll. Dr. Toll is Senior Vice President, Residential Services at Aspire Health Partners. Dr. Toll is someone that I spoke with We just have a few minutes left, but as I spoke with Dr. Toll, I want to say in April. Dr. Phil, are you there? Are you on?
Yeah. Yes,
Okay.
I am.
Wonderful. Dr. Phil, we have a question for you, and I will tell you before I read this final question, and thank you for those that stayed on the webinar. For those of you that logged out early because of other commitments, we're going to send you these questions, and we'll call this our overtime period. But Dr. Toll, you and I met in April, May, as the pandemic began, to do some videos for Aspire. And I remember you telling me, it stuck with me. I remember you telling me that Andre, these shutdowns, lockdowns, quarantines that we saw around Florida, around America, although they might be necessary, I mean, we've never done this in the history of humans. That's what I remember you saying to me. And we're going to see an impact that we've never seen before from a mental health standpoint. And now here's the question, kind of teeing you up. How did COVID-19 impact the services that were provided in your community? And maybe more than anything, did it impact people the way you kind of thought now, almost 1 year in? And what's your, you and Aspire, what is your paradigm now on the mental health crisis caused by COVID-19?
Well, clearly it's impacted all of us in a major way, as many speakers on the call today have already indicated. One of those is that we're now in our third wave of this pandemic, and the numbers just keep climbing higher and higher. And the resources that we typically have in order to deal with major life stressors don't exist for us, are no longer available to us, dinner with friends, activities outside of our homes, et cetera. So the quarantines, the limitations have been great. And we really been key to tap into the major resilience that we all have as human beings in unprecedented ways. So really thinking outside the box. Our services, fortunately, from acute care, detoxification, have never been interrupted during the pandemic. Following CDC guidelines, we've been able to meet the needs of those clients. But getting back to Sheriff Lima's statement, even if we intellectually understand the need to stop using, we're not yet ready to stop using when it's one of the few coping mechanisms, albeit an ineffective one and a very dangerous one to use substances. But people are maintaining their use because it's one of the limited resources available to them to cope. Again, albeit a negative one. So even though they understand the need to stop, they're not yet stopping. So it is on the rise. And that is one of the reasons to explain an increase in numbers. So what are our next steps and what do we need to continue to do? Telehealth has been a significant, one of the most significant interventions we've been able to utilize. What's key in our next steps, because we have long-ranging impact that we do not yet know of this pandemic. Not only from a substance use perspective and a behavioral health care perspective, greater than 50% of Americans indicate anxiety and depression as a direct result of COVID-19. Our numbers are increased significantly. 65% of our workforce went to telehealth within 3 days. We went from 100 calls or 100 telehealth services a month to 22,000 services a month. That is still significant and very much needed. What we need now is also to recognize, because we're going, month by month, are we going to continue reimbursement for telehealth? Are we going to continue reimbursement for telehealth? We need to permanently allow for reimbursement of telehealth services because it's going to be the way of life for a very long period of time and probably for the future. The other piece of it is also parity. One of the things that's really essential that we talk about from a behavioral health care perspective is equal expenditures of dollars for behavioral health care services, just like Dr. Wall is talking about, access to MAT. It really is the most successful intervention for opioid dependency is MAT, and yet not all individuals have access to that. So parity allows for equal access, and it should be equal expenditures for behavioral health care issues as there are for medical. Federal law has been in existence since 1999, and yet there's not enough teeth in the law. There are not equal expenditures. There are limits to benefits, far greater limits to benefits for behavioral health care than there are for medical. So if we have any hope of continuing to have a significant impact on opioid dependency and our behavioral health care issues in general, we really need to have parity. One final thought that's really key is continuing to reduce the stigma. Dr. Wall indicated that even though it is the best practice to use medication-assisted treatment, there's still a lot of stigma around the use of MAT when it comes to opioid dependency, and that we need to eradicate as well.
Thank you, Dr. Toll. And I will tell you one kind of final quick question for you. We're going to get everybody off here. Many had to drop off, but we have some folks, a lot of folks still on. We're going to get you out of here in about 60 seconds. But Dr. Toll, when you see the numbers of overdoses that continue even after the quarantines and lockdowns, shutdowns in Florida have all been taken away, does it surprise you that going into 2021, we're still seeing record overdoses compared to 2019, or is that not surprising to you?
It's not surprising at all. When we talk about a human being's ability to cope, particularly in a pandemic situation where, again, none of us have any experience, there's still a tremendous amount of fear out there. Even with the immunization coming on board, there's a lot of fear about the immunization, and we're not out of the woods yet. We need to continue to take a look at our capacities to cope that are greatly diminished, and currently still little resources available for us to overcome those.
Got it. Thank you so much, Dr. Toll. And again, where do we go from here? We're going to be talking about our new partnership with Solutionize. Thank you, Solutionize, so much for what you're doing around America. And now I think people are going to be very excited about the new, what I'll call continuum of care that we're going to build on overdoses and those at risk of overdose in Central Florida and around Florida. Don't miss our legislative meeting. The link to that is in the chat. Legislation is critically important. And don't miss March the 24th, that meeting, location to be determined. And thank you for attending our webinar. And lastly, but not least, if you are watching this webinar and you're not involved with Project Opioid, send us a message, email me, text me. We want to get you involved with Project Opioid. From all the leaders on Project Opioid, I want to say thank you for your passion, your commitment, and we will be talking to you very soon. Andre Bailey, thank you for your leadership, and we'll see you again in the near future.